Motivational interviewing is a counseling style that embodies a directive, client-centered approach aiming to enhance a client's motivation and ambivalence. Motivational interviewing is used by practitioners to reinforce positive behaviors, which is used by highlighting the benefits of a specific behavior. Practitioners are able to use motivational interviewing techniques to facilitate a client's willingness to engage in long-term physical activity participation through acknowledging the health benefits of doing so. The benefits of exercising include enhanced alertness, strengthening of bones, muscles, and joints, and overall increased mood and mental health. Motivational interviewing can be adopted by practitioners in an exercise or sport motivational context to encourage clients to have faith in reaching optimal physical and mental health. It is the practitioner's responsibility to make the client feel supported and confident in reaching their individual physical exercise goals. The 4 key principles, as well as the spirit of motivational interviewing, are used to motivate clients to engage in physical activity in order to avoid spiraling into a long-standing sedentary lifestyle, behavioural choice that may lead to major health risks. Obesity, high blood pressure, specific cancers, and mental health issues are major physical and mental health risks associated with a lack of physical health. In order to encourage people to engage in physical activity, the principles of rule must be used by the practitioner. The acronym of RULE is resisting the righting reflex, understanding the client's motivation, listening with empathy, and empowering the client to change. Resisting the righting reflex is a technique used to push clients towards good health. Clients that are ambivalent to change are likely to respond and persuade themselves that their behaviour is acceptable. For example, a client who believes physical exercise is only necessary once a week may be opposed to changing their specific behaviours. This is referred to as the righting reflex. The practitioner helps the client to suppress this reflex through motivational interviewing. When the practitioner uses an active and client-centered approach alongside a motivational and empowering attitude, the client is more likely to be influenced into a healthier, more active lifestyle. Understanding client motivation is significant when delving into individual interests and values, which is significant for the practitioner to develop a better understanding of barriers to change. For example, someone living in rural and remote areas may find it hard to access services such as gyms or pools, etc., that may limit motivation to change physical activity. Understanding these barriers allows the practitioner to find and discover alternative approaches to exercise that may motivate a client more to change. For example, going for a 30-minute walk a day along the countryside. Moreover, listening to the client with empathy is essential for the client to acknowledge that you believe in them too. Effective listening skills are significant, and the session should be equally listening and talking. Listening with empathy allows the client to become more comfortable, allowing for the practitioner to better understand ways to change clients' behaviour as well as their specific goals and what they want to achieve. This can be done by reassuring the client that their lack of desire to participate in physical exercise is completely normal and common. However, they must offer assistance and strategies to help increase their motivation. Empowering the client to explore and make their own choices is essential in grasping an idea of the client's readiness for behavioural change. The practitioner must conduct the session through a non-judgmental and supportive lens to help the client instill self-awareness, motivation, and a sense of autonomy. This requires understanding the client's own ideas and past successes in improving motivation when engaging in physical exercise. However, Empowering the client to engage in regular physical exercise comes from forming a therapeutic, trusting relationship as well as embodying hope that they can change too. For example, acknowledging the advantages of joining a team sport, being making friends and increasing serotonin levels, alongside having an optimistic mindset toward the client's success will make them more intrinsically motivated to achieve and have fun. The rule principles are significant to draw on when implementing the spirit of motivational interviewing in practice. The spirit of motivational interviewing is significant for the client to achieve their goal in physical activity as well as develop a sense of autonomy. Collaborative partnership, evocation, and autonomy, as well as are spirits of motivational interviewing that help build motivation to change, as well as strengthens commitments to that change. Collaborative partnership involves the practitioner acknowledging and understanding that the client knows what's best for them, what motivates them, allowing for a more client-centered approach. For example, the practitioner can offer their professional advice on motivation, however, must acknowledge and encourage the client to discover what motivates them the most. Evocation is another spirit of motivational interviewing that aims to encourage a client's willingness to change their behaviours. This may be done through giving beneficial reasons for engaging in long-term exercise participation. For example, highlighting health benefits, for example, improvement in mood and enhanced well-being, as well as acknowledging the health risks associated with little to no exercise, will help motivate the client into being more educated surrounding the benefits of physical activity. The practitioner must delve into the client's personal goals and wishes, as well as understand what motivates them the most. For example, whether they are more intrinsically or extrinsically motivated. Lastly, autonomy is used by the practitioner to point out that it's the client's own choice to change their perception on physical activity. In order for them to participate, they must want to. This can be done through encouraging self-confidence and the development of a goal-setting strategy. For example, at least 30 minutes of physical activity per day, whether that be walking or strolling or running. When this realistic goal setting is achieved by the client, the practitioner may encourage them through positive feedback, which in turn enhances intrinsic motivation and their desire to keep being physically active. The 4 key principles and spirit of motivational interviewing are effective in changing a client's long-standing sedentary lifestyle, behavioural choice of limited physical exercise towards engaging in long-term physical exercise through encouraging goal setting and autonomy. Motivational interviewing is effective in enhancing intrinsic motivation due to the combination of these two, that is further reinforced through a non-judgmental, client-centered approach.